By the US
an appointment in the next 3 months, in the next 6 months, some of them. Or, once you're here from Chico's experience and from other vets that I spoke to and from yourself.
something big, surgery that can cost hundreds of thousands of baht. Some vet may not have enough money
Exactly,
to
exactly.
pay up front.
Okay. So
All right.
Mr. Chairat,
Yeah.
right?
Chairat.
Chairat.
Yes, my name is Chairat.
So you can start over and tell us more about yourself if you don't mind.
Sure.
Thank you.
Okay, I'm Chairat. I was born in Thailand, in Krabi, and when I
Are you
turned
from the South?
right from the south, when I turned 20, I went to America, and then I joined the U.S. Army from Los Angeles. Signed up and then went for training and then became the medic, 91 Alpha back then. And then after 3 years, up to tanker unit, Kansas. So I want to change it to something else that's more stable and work in the hospitals. So I learned more. So I went to reclass to 91 Charlie back then, which is a practical nurse. So that's 1 year school. So after I finished with that school, so I went off to Germany and many other places, to Kuwait, back to America, and went to Korea, and went to Iraq again, the second tour in 2001 or 2002. So I participated in the Iraq War twice. During my career, 42 years, and I retired in 2007. After that, I will work in the hospital administrators, American Army Medical Center in Washington State, Fort Lewis, Washington, for about 6 years. And then I decided to leave and return to Thailand, back to Chiang Mai in 2013.
Okay.
In 2013. 2014, I stayed in Chiang Mai and got bored, so I asked for a job at Bangkok Hospital, Chiang Mai. So they said, sure, you can join us. So since then, I've been working with Bangkok Hospital since 2015 until now, so almost 10 years now. And that's what I've been doing, taking care of international patients, especially the American and the veteran of mine.
Okay.
So we can lead to why I'm doing this.
Okay, very well.
One question too. Again.
Okay, so basically, when you first started with Bangkok Hospital, were there a vet program there?
No, there wasn't. They don't have the TRICARE. They have the FMP before I got there, but kind of not really well known by the veterans. So when I learned about the FMP foreign medical program, then I kind of study and learn more about it from the veterans and also from on my own, and then make the program stronger and much friendlier for the U.S. veteran that's staying in Thailand, in Chiang Mai especially. And then after that, a few years or 4 or 5 years after that, from 2015, I said, why don't we have TRICARE here? They used to have TRICARE program in Bangkok Hospital in Bangkok, but they canceled it because some problem with payment or something. So, but I want to do that. So I studied about TRICARE from Bangkok Hospital Hua Hin. So they have that. So I learned how to do this, how to generate or create a website, or how to get the program started. After a few months, so I tried to convince my hospital director back then, say, sir, could you please accept or consider it the TRICARE U.S. military program here at the hospital. After a year, he said yes. So that's why I get kickstart, contacting the TRICARE in Singapore and working to help me set up. So finally I got it going, then I train people or give a classes to staff like a cashier, accounting, and nursing staff, doctors. What is TRICARE about? How they do it? How do we file for reimbursement? What eligibility? What they will pay or they not pay, all those kind of things. That is started of the TRICARE program at Bangkok Hospital, Chiang Mai.
And so you spoke of TRICARE. So is that also TRICARE plus the
FMP
program?
Correct.
So both programs.
I do both programs.
Work hand in hand.
Yeah, hand in hand, and then I add another one to it. We call the VES, Veteran Evaluation Service. This is the subcontractor of the VA.
Okay.
This VES, what they do, like they kind of contact the veterans, the one that retire already from the military, and they want to claim for service-connected disability.
Okay.
So this agency we contacted me, somehow they found me online, and so they contacted me. So we do business with them we have our physicians trained on VA stuff. After the training, they can do evaluation for veterans who are asking for re-evaluation of their condition.
Gotcha.
So
thank you.
So that's what happened. So we can do evaluation, service-connected disability evaluation for the veterans. So what they do when they have the cases, they will contact me, and then I will set the schedule for the doctors to do examination. It will convenient to both veteran and also the physician who do evaluation. So that what been going for a few years. So we keep doing that.
Okay. So I didn't know about that.
Yeah. This is a new thing. Nobody doing it.
Okay.
Know about it. No hospital in Thailand doing that, except Bangkok Hospital in Chiang Mai.
Okay. Because previously the guys would have to go back to the US to get evaluated if they are here already.
That's correct. Yeah, they have to go to certain countries that's available for them to be seen by a physician or back to the state.
Yes.
But now they can do it here in Thailand.
Awesome. That is good news that we didn't know about.
Yeah. So if they plan to move to Thailand, they got like a 3-in-1. They have TRICARE availability service you can use if you retire with that benefit. Right? If you just serve and you got out with FMP, VA benefit, you can use that in Bangkok hospitals. But if you want to file, or they want you want them to really look at your disability, we have contract with the VES, Veteran Evaluation Service. They can do that too. So it's very convenient for US vet that want or thinking or considering to move to Thailand, especially in Chiang Mai.
Yes.
Yeah.
Definitely awesome information to know, and I know that Chico is benefiting from it, and I myself is benefiting from it.
Right.
So that's awesome.
That we didn't know about.
Yes.
Yeah, that's a new one. Not many people know about that. Yeah.
So you've explained to us how the hospital collaborate with the US for TRICARE, and tell us a little bit more in depth. What do you guys do once we go to the doctor in Bangkok Hospital? Where do we go from there?
Okay, let's seeing that if you are eligible for either TRICARE or FMP or both, first thing we need you to do, you come in to register, right? Register with the hospitals and provide the information, and we can do for TRICARE we do Social Security check to make sure you're eligible online. Check with the websites, TRICARE overseas program website. After that, you can start using the TRICARE. If you are claiming that you have service-connected disability, we want to see your VA letter, FMP letter, that's stating what service-connected disability you have. So we have at least 1, 2, 3, 4, 5, whatever. Then you can use those service.
So the two for VA service connected, you need to have your letter from VA,
That's correct.
your award letter with all setting all your service connected disabilities.
Correct. Yeah.
And whether or not you award it or not for it, as long as it's on that payment,
Right.
you can be seen.
You can be seen for those condition or something that related to that condition.
Exactly.
Right. Yeah. So
And then for TRICARE, you will verify in the
TRICARE
TRICARE
system.
overseas system.
Make sure you're eligible for TRICARE program.
Okay. So for me, when we first enrolled in the program, I had to bring my social. Well, I gave you guys my
Right, of your spouse.
spousal
I mean,
card.
spouse need to bring the sponsors,
The
social
card.
security.
Exactly,
Right, just,
exactly.
just tell us the numbers.
Exactly.
And then we can check it and we look at the ID card, make sure the name is matched
Matching.
the system, right?
Yes.
Yeah.
And then for Chico, when Chico registered, he also had to give you his for TRICARE and also his VA award.
That is correct, yeah.
Yes.
So both.
So just in case it's not covered by VA, it's not on that award letter, he can use TRICARE for that.
Right.
Okay.
So they are different. These two different. You can choose and pick which one will benefit you the most.
Oh,
So if you like to know, I can go in depth what to use either between TRICARE and FMP if you are eligible for both.
Okay. So we're not gonna go in depth with that because different people have different different situations. So
Right,
definitely, but we understand that we can use it here in Bangkok Hospital.
Correct. Yes.
Tell-
Bangkok Hospital, Chiang Mai. Yeah.
Tell, is it as what I was gonna ask you? Is it only in Chiang Mai you can use that program?
These two programs, I got good news. A couple months ago, my new directors have authorized it or supported the expansion of the TRICARE FMP program. So he is the CEO of Northern and Northeastern region of the BDMS. BDMS is the Bangkok Dusit Medical Center. It's a big umbrella of the healthcare system in Thailand.
Okay.
So they have over somebody interested. They have over 50 hospitals throughout Thailand. So I asked him, can we expand it to other provinces
Okay.
in northern Thailand and also northeastern that he have control, which is about 10 hospitals.
Okay.
So he agreed to it and he's supporting it. So we have a conferences with those hospitals. So I was able to recruit 4 additional hospitals, Bangkok Hospital, to join TRICARE and FMP program.
Okay.
So they are Chiang Rai, Bangkok Hospital, Udon, Thani, Bangkok Hospital, which is a lot of veteran there too, Khon Kaen, Bangkok Hospital, and also Nakhon Ratchasima or Chairat, Bangkok Hospitals. So we got it right in the middle of Thailand, the
Okay,
gateway
okay.
to northeastern or to the north and northeastern.
Okay.
That's another big provinces.
Okay.
And then have a few veteran, U.S. veteran live there, Khon Kaen and all around those provinces. So now we got the Udon Thani is already started to receive patients, both TRICARE and FMP, just 3 days ago. So they kick-started, so they're happy, the veteran happy
That's
to have
awesome.
that going. So I'm working with Khon Kaen, Chairat, and Chiang Rai to get them going. So going to be more coming by the end of this year or early next year. So we have more accessibility, healthcare for our U.S. veterans in Thailand. And other Bangkok hospital that have the TRICARE and FMP is Bangkok Hospital. Not Hua Hin, I say it wrong at the beginning. It's the what the name? Chonburi, Pattaya. I'm sorry from the beginning. Bangkok Hospital, Pattaya. That's the one that have
That started it.
They started for a while. They have, but they're limited though.
Okay.
For example, some hospital like Pattaya, Bangkok Hospital, Pattaya, they only accept like inpatient FMP
Oh,
only,
I see.
or inpatient TRICARE patient only.
Okay.
Like Bangkok Hospital in Bangkok accept FMP inpatient only. So no other Bangkok hospital except Chiang Mai and Udon now that accept everything. OPD, outpatient, inpatient, so That's the advantage that's staying here in Chiang Mai.
So, not in Chiang Mai, in the other province, if you are a vet and you live in another province,
Okay.
can you still use your benefit as a vet at the hospital? But what is the criteria there?
It's same thing at the Bangkok Hospital Chiang Mai. So you have to show your, for example, for VA, the FMP, they have to show the letters of the VA FMP to the hospital administration or registration. For TRICARE, they're going to ask for your social security and they can go online to verify, make sure that you are eligible for those services.
Okay.
Same. Because they learn it from us.
Okay, but what if it's not connected to the program that you have? What if, I mean,
If they-
Phuket and I'm a vet and I want to use Bangkok Hospital in Phuket.
Phuket,
Phuket.
right?
I always say it wrong.
Okay.
Are you able to use your benefit there, or can you use the medical facility there and then file for your claim, or how would you do that if you live in that province?
Right. If you live in, for example, you just mentioned Phuket, right? They can use, technically, we can use any medical facility in Thailand, and then you collect the invoices and the receipt, and then you file for reimbursement.
I got you.
You know, if they don't accept these two programs, so there's still accessibility throughout the country.
Throughout the country, that's what I wanted to make
Right,
sure.
right.
Yes.
So, but they have to pay out of pocket.
Pocket.
The small amount is okay, but if they have to do something big like surgery that can cost hundreds of thousands of baht. Some vet may not have enough money
Exactly,
to
exactly.
pay up front.
Okay.
So that's why having these two programs available at many hospitals that you can help alleviate this burden of the financial burden
Okay.
for our veteran and family.
Okay. Can you live in one province that does not have that program and register in a different, let's say Chiang Mai, register in Chiang Mai and come here to do your medical if you need to?
Yes. If let's say you live in South Thailand, in Phuket or wherever, and you want to, and you are eligible for TRICARE or FMP, right? You can fly up to Chiang Mai and get the medical care. Same as people who live in Chiang Mai. Just show your eligibility, your letters of the VA. We have people, the veteran that fly in from Indonesia, Philippines, America, other country, or even provinces up to Chiang Mai just to use the medical services.
Okay.
Because they don't have to wait. Right? Accessibility is easy. You can be seen, you can get things done right away. So some VA, some veterans in America, they say, I can't wait for my surgery, take 3 months. Can I come to your hospital to get the surgery done? Say, of course, if you're eligible, you can fly over here and get it done tomorrow if you like. And then you can recover here and go back. You know,
You can recover in vacation land.
And you pay nothing.
Exactly.
You pay nothing.
Exactly.
If you bill with 10,000 baht or more, we do direct billing for you. So it's very convenient.
Okay, did you guys hear that if it's 10,000 baht or more?
Yeah, that's the guidance we use.
Yes.
Okay, but we're flexible on that also.
Yes.
Some may not keep 10,000. You know, we can talk about it.
Exactly. So the next day service that you just talked about, that Chico had an example for this week. Not this week, today's Monday, last week.
Eye something surgery.
Yes, he came in. I emailed them on Monday, on Tuesday, and then they gave us appointment for Wednesday and Thursday and Friday.
Right.
So it's like immediately you call or you email and you get your appointment like right away.
Correct. You get your attention. You get attention right away, and then respond to you and get you in as soon as we request it.
Yes.
So that's the.
And it's a request. You said that correctly because one of the issue that he had is with his eyes. When he was in the States, they told us 3 months. When we came here, it's when we went to the hospital on Thursday. They asked us, when do you want to do it? He was like, oh well, next year. They was like, you can get it done before the year ends.
3 days.
Yes, and the follow up is awesome. I mean, they've called you so many times just to ask you different questions to make sure that everything is in order. So it's just exceptional service that we received so far.
Yep, that's what I like the most. You want to get MRI done, CT scan, whatever. So they can do it right away with a day or two or same day.
Yes.
Get things going. They have to wait for months to get something done.
Yeah.
Yeah.
Get the results right away too.
And so I would say you and I got that email this morning with all your X-rays and all that. What they call it, the investigation. All the investigation came to me this morning.
Yeah.
So so it's an awesome program that you've started. I would say you started and you're still working so hard.
Doing it and expanding it.
And expanding it.
My goal is to get it as many Bangkok hospitals except TRICARE and FMP.
Awesome.
As many I can before I let go of this thing and retire for real.
Retire for real. So he can enjoy his life.
Yeah.
So where are we? Where were you when we you let us know how the program benefits vets here living in Thailand. You just spoke about that. Anything specific medical service or support system designed for vets, unit, PTSD, what kind of rehabilitation? Let's talk about that. Yeah.
Let's say we have many veterans suffering from PTSD. So we have the team we call mental health team that can evaluate it and treat it. PTSD patient. We have many American vets that come to us and being evaluated or seen or treated by our psychiatrist.
Okay.
So that also accessibility.
Okay.
And I also have a friend of mine who is a psychiatrist and he has his own clinic. He's a psychiatrist that used to work at Bangkok hospitals and he has the clinic nearby the hospital. He also does the TRICARE and FMP benefit also. So we have many veterans that went to see him. And he also doing a VES, veteran evaluation service. So he can do 3-in-1. This is the real guy to do 3-in-1.
Wow.
Same in the hospitals.
Oh, so and he's not attached to the hospital?
No, he used to be one of the team members, but he resigned and he started his own clinic, his own practice.
Oh, wow.
So now, he's doing all that stuff for us.
Okay, that's
too.
great. That's wonderful.
Because I asked him to do it.
Oh, wow. That's awesome.
So he did. Yeah.
What about if a vet is on dialysis, like they get in?
We have the dialysis, kidney dialysis available at Bangkok hospitals, dental, everything, all the services that you need.
Oh, you have dental too?
Yeah, we have dental, we have urologist, neurologist, cardiologist, everything that medical center have, we have it.
But for the vet, anything that they could get in the U.S.
They want,
veteran center.
yeah, they could get or couldn't get there. They can have it here without waiting. So if they want to come here and live here, or just for the service, or just for medical service, they can come.
That's awesome.
They get choices.
That's awesome. You can come on a vacation.
Yeah, and get it done.
Get everything done and
Go on vacation and go back.
and go back. Yes, definitely. Oh,
Or
wow.
move over here and stay here.
And stay here, for real.
It's a nice place.
Easy life. come have breakfast in the cafe like us on Monday mornings.
Yeah.
That's awesome. That's awesome.
Uh-huh.
So what else? What do you want to tell us about? Well, Chico, I would say Chico is a success story because from the time we enroll to now, whatever he needs, he just call. He just actually he don't even call. He just email.
Email and you get the response right away.
Pick up the phone or email. So we take care of you guys right away.
Within 24 hours you get a response.
Oh yeah.
And you get the appointment.
That's correct. Yeah.
So I think one of the questions that I wanted to ask you, we kind of like cover it. How do you get continual education? Medical treatment. If you are here, there, or in Hua Hin or in Bangkok, you can come back here if you want, or you can go to one of the
hospital that
that
accept there. Yeah, you can go to the nearest Bangkok hospital that accept TRICARE and FMP at your conveniences.
Okay.
Yeah, so you can choose where you want to go.
And you spoke of the expansion. So far, you have here in Chiang Mai, in
Udon Thani, Khon Kaen, Chairat, and Chiang Rai. So 5.
and that's
2 is
5
running right now.
Yes.
3 is on the way.
on the way.
Right.
And how soon will you expect?
It's the other 3 would be 2 for sure would be early next year in January.
Okay.
And the Chiang Rai one might take a bit longer because the baby ones. It might take
Okay,
a little bit longer, maybe in February.
Okay.
I would
Well,
say.
that's still not
Yeah,
too
so
far.
my goal is to get them all first quarter of next year, 2025. Maybe all five. I mean, the other 3 or 4 we start running with the FMP and TRICARE programs. Yeah.
And so I just wanted to make that clear that you don't have to be living in Chiang Rai or in one of the provinces that he just spoke of to be able to participate in the direct billing for the FMP and TRICARE program. You can live anywhere in Thailand and be able to come here, fly here, or if you decide that you want to pay out of pocket, you can use your benefit anywhere in Thailand.
Right.
And you will do your own filing
Yeah,
for
yeah.
your claim
Right.
with VIA, which takes a long time. So you might want to just buy
It is.
buy a plane ticket and come here.
Yeah, the reimbursement process for FMP is kind of long time. It could be 6 months, could be a year. So that's why having the hospital that give a credit for FMP save your money. I mean,
Yes,
you can use your
yes.
money, and if you don't have it, you can use it for something else, and then let the
Yes.
hospital take
Do
the
the-
burden.
Take care of that, yeah.
Definitely.
Because they have a lot of money to spare for those programs. Yeah.
And so Bangkok Hospital, I mean, meets and exceed all the needs that US vet or any medical facilities has. I mean, we go in there, everything, they have all the medical machines.
Yeah.
It's top of the line.
Rehabilitation,
State of the
whatever,
art.
state of the art, modern technologies, private room for your
Yes.
inpatients, cleanliness,
Cleanliness is
accessibility,
awesome. Yes.
friendliness,
Yes.
services. I mean, this is amazing that many, not only the veteran, also the foreigners from all over the world, when they came or they come to Bangkok Hospital or hospital in Thailand, they say it's better than their own country. You know, friendliness, cleanliness, services. So they say we cannot beat you guys.
Yes.
Thailand is one of the best
Best,
hospital
one of the
hubs in the world.
Yeah.
Yeah.
There's a lot of medical tourism here in Thailand.
That's correct. Yeah.
Yes,
yeah.
a lot of
That's
medical
correct.
tourism.
Many.
So you're a vet. What advice either one of you guys will be able to give to any vets that's considering
Coming to Thailand.
coming to Thailand to live?
I would say this, the cost of living, and you guys been experienced already, is it not that high like in America? People are friendly. They like to help you. They're a lot more friendlier and safety. You can walk around, you don't get mugged or robbed by or things that we experience in some other town in America. The medical system is wonderful. Accessibility, especially the veteran of TRICARE and FMP program. You cannot ask for any other places that you want to retire than Thailand, because they have, from my knowledge, there is no hospital in any country besides America that offering the credit for TRICARE and FFP. I mean, you can go to any hospital around the world and pay up front and file, but they don't have TRICARE, FMP, accessibility at those hospitals in any country. That's all I know.
Yeah,
Thailand.
definitely,
That's the only
yeah.
one I have in Thailand.
Yeah.
So that's one thing I'm so proud of at the veteran, U.S. veterans. And I want to get this booming or getting expansion in Thailand only though. That's all I can do.
That's all you can do, yes.
Yeah, yeah.
Because you're in Thailand, you're Thai, you're
Take care
American.
of the
Yes.
veteran,
Yes,
U.S. veteran
yes.
in Thailand.
Yes,
Especially Bangkok Hospital
Yes.
and its branches. So
Okay. That's
Yeah.
awesome. What about you, Mr.
For me, I can speak from experience. It's an awesome program. Accessibility to healthcare, the appointments, And you call one day and you get the appointment the next day. They explain everything to you. The beauty about it is once you already have your services and the hospital file for you instead of you filing for yourself, so you don't have to worry about that. Cost of living in Thailand is extremely low.
Extremely low?
Yes, it's extremely low.
Compared to the US.
Compared to the
Yeah,
West.
yeah, yeah.
Compared to the
Compared to
West,
US, yes.
it's extremely low.
It's low, much lower, yeah.
You have a calming spirit. You don't have to worry about crime, and it's just
As the US.
less stress. It's a stress-free
That's the
life.
key.
That's okay. That's the key.
Less stressful.
Soft life.
Yeah.
Soft life.
If you plan to retire, enjoy life, scenery, food, people, environments, you gotta come here.
Definitely, definitely. And if you are a US vet and you have medical problem, because a lot of people that I speak to, they're still, that's the reason why I asked you about the dialysis. You know, they'll say, oh, I'm on medication and I need to make sure that I get my medication. One of the things that I've learned from you and from the hospital is that as a US vet or TRICARE, the medicine that you will receive has to be
Yes, FDA approved, right? That's the one key person.
Yes.
Right.
So you can, so your medical, your medicine will be covered by your TRICARE. If it's something that you've been taking from the States, then you will get the exact same.
Yep. Same thing here.
Medicine.
Right.
So it's not an issue to worry too much about, or any other of that issue. Your dialysis or
If you have a child with mental health problem, we have that also.
Exactly.
Child psychiatrist, psychologist to take care of your kids.
Yes. So all the medical facilities, all the medical treatment that you can receive in the US, you can get it here. Without the beauty, the caveat on top of that, you're not gonna wait. You're not going to call your doctor and tell them your issue, and they'll say, oh, we cannot give you an appointment in the next 3 months, in the next 6 months, some of them. Or, once you're here, from Chico's experience and from other vets that I spoke to and from yourself, you get an appointment almost immediately. And when I say almost immediately, I mean like next day, 2 days later, you'll get an appointment and be able to be seen.
Right. Yep.
Top-notch doctors, and most of them speak English.
That's correct.
I haven't seen a doctor here or been with you to a clinic that the doctor doesn't speak English. Actually,
That's the requirement to work at Bangkok Hospital.
Oh, it is. I didn't know that.
English speaking. And I'm the one that do interview. English interview.
Oh, really?
For all new employees, except doctor.
Okay. Yeah, we have not encountered anyone that does not speak English. Yes. So that's a plus. That is a plus.
Right. So, yep.
Wow. That's good to know. So if you are a vet and you're thinking about coming to Thailand, a US vet, and you're thinking about coming to Thailand, even if you are a spouse and you're no longer, however, you are welcome to Thailand. You are welcome here for your medical treatment. You are welcome to come on vacation and do all your medical treatment, your dental, and whatever it is that you need to do here in Thailand. But we encourage you to move here. It's a peaceful, calm, inexpensive place to live. And safe. Yes. Definitely.
Yes.
So I hope that helps someone. One of the questions that I wanted to ask you, if vets wants to reach out to the hospital, yes,
they can go online and search for Bangkok Hospital, or they just type in TRICARE FMP in Thailand or in Chiang Mai. They will find information and my name and my contact numbers, emails. They can contact me. So I will respond right away within 24 hours.
All right, and I'm gonna make sure that I put that on the
and your
so they can have your contact. But if you can't get in contact with him, you can contact me, and then I can direct you to him. So that's no issue. If you guys are wanting to get any information, just please send us an email. I will put his email on the in the comments below, and reach out, see what information that you guys need, but he basically explained everything that you guys need as far as enrolling in the FMP program or using your TRICARE over here in Thailand.
Right.
Anything else we can share with them before we start drinking
Yeah. So
our watered down drinks?
welcome to Thailand. Yeah.
Oh yeah, definitely. Thank you guys so much. We appreciate you watching. Hopefully you guys learned something from this, and we'll see you guys here in Thailand pretty soon. Thank you guys so much. Bye.